All right, maybe it's going to be challenging today. Happy Father's Day. And we may keep it a little short. I don't know yet today, but it is a beautiful day. And I hope everyone's doing well. I spent some time with my daughter today, which was really wonderful. And spending time with family is real important. And I'm going to talk a little bit about male factor fertility, because sometimes the guys just don't get all the ideas and the help in all of this. And thank you for everyone joining today. And again, just a conversation of this crazy fertility journey. We had a really wonderful zoo party at the Gifford Zoo in Syracuse, and just thousands of children and adults and family members, and just the celebration. It's really wonderful. And this is a really big challenge, as you already know. And we're hearing and talking to people from all over the country and the world, and just this conversation about how we can improve the journey. And whatever I can do here to help in the process is what I'm here to do. And thank you everyone for joining us tonight, and really appreciative. It's a family day, but there's always going to be some of us that want to spend the time chatting and sharing, and remember likes and comments and all those things, and put you in the mismatch of all of it. And I hope you had a really wonderful Father's Day, spending time with your family, or even just spending time in nature, or however within the mind and the body. And this really big challenge is just hard for so many of us, and always here to learn. Now, you notice the fire's not on today. It's kind of a little warmer day, and so we're just going to keep it down. Again, thank you to everyone, and Will for helping always bring this together. And as the questions come, I'm going to really working to answer those. But we always forget about the sperm and the guys, and there's this idea that it does take a sperm and it does take an egg to make an embryo, and so we really don't have the greatest ability to say which one it is. So I always say it's both. And so that sperm, where does it come from? And the sperm takes 90 days or more to mature, and the testicles are always making new sperm throughout the time of the guy. And so we always forget that whatever's going on in the guy's body may be a factor. And even though we look under a microscope to see whether or not the sperm is normal or not, and we look at count and motility and volume, and then we look at the morphology, what does it look like? And it may be that it looks completely normal, but if it's not creating a pregnancy, then it still can be part of the factor there. And at times we're also looking at sperm DNA fragmentation. So this is a measure of inflammation, believe it or not. And so I always say that if the sperm that you have isn't working, even though the count and the motility and the morphology all look great, it still may come down to a sperm issue also. It's kind of an interesting thing. If the sperm is normal or has really great, fantastic, and all those things, flying colors, we kind of already put it onto the woman and the egg and the uterus. And really it's a frustrating process when, boy, everything looks normal and we call it idiopathic, but we blame the woman. So let's come back to the guy and realize that whatever's going on in the body, inflammation, and I go right to keto for the guys also. And guys probably should be slowing it down. Remember, all this gladiator sports heats up the abdomen. Heating up the abdomen, the belly, is going to adversely affect the lower abdomen, the pelvis. So there you have the prostate, the seminal vesicles. All of these things are going to be adversely affected. So guys, slow it down. Keto, Conception XR, vitamin D, CoQ10, ubiquinol, PQQ. All of these things are really helpful. And stay out of the hot tub, because remember, the testes are heated up, and in heating them up, whether you're exercising excessively or getting in that hot tub too much, it can damage the sperm. You may have great counts and motility, but the morphology may be affected, or the sperm DNA fragmentation. Now, I'm not a big one that let's go check the sperm DNA fragmentation, because I believe that it's likely part of the cause and part of the problem. And that's where we talk about even low-dose naltrexone for the guys. Again, the vitamin D, and slow it down. It really, really is helpful. And for many guys, you should be looking at testicular and scrotal ultrasounds and looking for varicocele. And if there's testicular, if the varicocele are there, which is dilated veins, basically I think they go along with hemorrhoids and hernias and all these other abdominal pressure problems and inflammation that's going to adversely affect the sperm. Again, if it looks normal, that doesn't mean it is. And so guys need to be looking at the same stuff as we are for the woman. And we have a sheet that I've been passing out, which is basically the global story, which says, okay, guys should be on the Ovasitol also. Ovasitol, like metformin, for metabolic syndrome. And my bet is for a lot of guys, they have metabolic syndrome. They have elevated hemoglobin A1Cs, and they're all eating high carbs and especially alcohol. You got to get rid of it. And there really is no good amount of alcohol if you're having problems and really trying to change it up. And so, you know, I'm always looking at the guy's side, but we often forget about it and don't focus on that. All right, I'm just gonna go right to Tara Rojas. How you doing? If a guy drinks a lot, does it affect morphology? My bet is, again, anything that causes increased inflammation in the abdomen, in the pelvis, is going to affect the sperm morphology, DNA fragmentation, motility, count, all these aspects. And even when it comes to sexual function, a lot of guys, because of metabolic syndrome, are going to have decreased libido, decreased testosterone. We're also using a lot of Clomid or letrozole, 2.5 a day of the letrozole, 25 milligrams a day of the Clomid, or adding HCG injections, 250 units sub-Q daily, which will directly increase the testosterone in the guy and may help boost the sperm quality, quantity, and reduce some of the inflammation in the area. And in some guys that require supplemental testosterone, you have to be on HCG supplements also in order to increase sperm production. When you take testosterone, it lowers sperm quality, quantity, and may shut down sperm production altogether. And it may take 3 months or more. So I like to say, you know, if you check the sperm every month, you'll get an idea whether or not anything's coming back. And then if after 3 months you're not finding any still, so the guys who are azospermic, then that's the time to consider doing a testicular aspiration biopsy or an open biopsy. I know it sounds terrible, guys, but it really, you gotta look really deep in there sometimes, because it may look like there's nothing in the ejaculate, but you can find it in the testes. So it's just something to keep in mind. If you have a high LH and FSH level and a low testosterone and no sperm production, it may mean testicular failure. But even in some cases where it looks like failure, and you add the supplements and you slow it down and you do everything keto. And remember, keto is always check out Maria Emmerich at mariamindbodyhealth.com and send her likes to by the way. And she does a lot of personal individualized coaching to help out on that side. So, but you sometimes cannot see the sperm in the under the microscope, but you can find it if you dig deep, and sometimes you have to dig deep. Dr. Trussell works with us in Syracuse, seeing clients from around the globe and the country where nothing else is working. But we do a lot of male factor fertility, and we're here to consult both men and women, couples, either whatever the gender mix is, at CNY Fertility, Syracuse, Albany, Rochester, and Buffalo. We're here to take care of your fertility needs. And one of the things that we know is we're the most affordable, accessible, and we're always there to integrate Eastern and Western processes. And one other interesting idea is look at acupuncture, abdominal massage for guys, and light therapy. And there's even some evidence that direct light therapy to the testicles, the scrotum, and the penis may be helpful. So, you know, if it's reasonable to try some of these things. So, hey Linda, how you doing? Second beta tomorrow. Well, let's see. Okay, put only site. Let's see. I'm gonna keep this. All right, so we're hoping the second one's going to keep on going up, and remember, I do believe in PGS testing and pre-implantation genetic screening, but it's not something I push or promote because an embryo, the only way it's going to get a chance to be a baby is if it gets in the uterus. So that's really, really, really important. And remember, so many of these things that we're talking about for the guys and the gals, it really goes the same way. So many women have polycystic ovarian syndrome or metabolic syndrome. Guys, you have it also. But since you don't get menstrual periods, you're not getting all of this, the menstrual dysfunction, excessive hair growth obviously isn't an abnormal thing on guys. And the same thing with acne and other androgenizing things that women get, it's more normal in guys. And so you need to look at the sperm count and look at the morphology. Those are good directives, but ultimately, if you're not getting pregnant, either naturally with IUI, IVF, even ICSI, there may be a sperm defect, and I always say it's 100% the sperm, it's 100% the egg, and both of those come together to make it 100% a beautiful embryo. And don't always chastise the egg. Even in more mature women, their late 30s and 40s, you still got to look at the sperm. And in some cases, we're looking towards donor sperm. Even donor sperm is to say, okay, we don't know if it's an egg or sperm issue. Let's take donor sperm and partner sperm, and let's inject some eggs or add sperm to the eggs to see what happens in all of this. So. Richie Charles, how you doing? Are there any support groups or employees at CMY with support for just the men going through IVF with their wives? Well, not yet, but we definitely need it. And the guys, you know, these are some areas that we should probably be talking more about and creating the online support, the online conversation, because such a focus is on the women. And maybe if we focused more on the guy's side, they will learn to take care of their bodies better. And that's what we all need to be doing. And if you look at my TEDx talk, and just Google Dr. Rob Kiltz TEDx talk, The Human Ferrari, through Onondaga Community College, it really is a different concept that I've been learning. And at 62, where I'm really just keto all the time, as much as I can, and from time to time I fall off the trail, but it's a practice that all of us should be doing. So Richie, we certainly need to focus more on adding that either in combination or separate or both, and I'll put that as a priority. Hello Sarah McCall. Well, the energy drinks, you're right, and they're a challenge because they have a lot of sugar, and obviously the sugar, and if we're having them all day long, it's not good. Once in the day, less adverse, but again, it's just a whole different change. And so, you know, the more we talk about this and how to take care of the human Ferrari for the guys and the gals and all of us together, we're working to a different path, a different way. So really appreciate that, and we do need to work hard to help with that. Let's see, Idaho, how you doing, Jessica Richards Bateman? Oh man, it is hard traveling to get bad news. Oh, absolutely. And you know, we're all working together, and I'm working to help just share this story that you could spread it around. And we're getting so many people, like we have the consult, or you just hear from this and it's a keto baby, or recently laparoscopy, hysteroscopy, LDN, and keto. It just, boom. And that silent endometriosis, listen, it really is a factor. And for so many, I'm hearing, hey, we looked and we found it. It might not be a lot, but this silent endo, which can be hidden for so many. And I know who wants to have a laparoscopy. It has a little teeny tiny bit of risk, no doubt about it. But the rewards are great. And that's really what we're helping you find. And I didn't believe it about laparoscopy, hysteroscopy either. And let me continue, Jessica. Husband is on Clomid and testosterone is finally normal. On Clomid and the testosterone is finally normal. That will help the morphology and motility, absolutely. Both on Clomid will help. Have been diagnosed as secondary infertility, but have 2 natural pregnancies, so I'm confused. Well, get rid of the terms primary and secondary infertility. If you're struggling to have a child and it's not happening, whether you're miscarrying or not getting pregnant, it doesn't matter. The terminology confuses me also. But basically, it really is focusing on the sperm, the egg, the embryo, both bodies, the Ferraris that you are. And it's really changing it up. And natural is kind of part of this conversation. Slow it down. Look at the supplements we recommend. Conception XR for the guys, Ovavite for the gals, vitamin D extra if you need it, and get those checked. And make sure you check thyroid and prolactin for men and women. And likely we should be looking at more testosterone levels for the guys, also looking at metabolic state, looking at evidence of diabetes and other immunologic disorders. And like alcohol is out. And there was recently the American Medical Association was working with some of the alcohol manufacturers and proving that some amount of moderate alcohol intake is healthy for you. And thankfully that got nixed by the NIH. It's stupid, excuse me, that medicine should be even suggesting that alcohol is good for us. And I'm telling you, no way. And Tabitha Lewis, thank you. Keto is king. And the paleo is princely and okay. You can do it if it works in some, but keto is kick ass amazing. And again, check out Maria's stuff. And I go way to the other side, bacon, eggs, butter, beef, bam, it's amazing. Get rid of the complex stuff that basically ferments in your belly, makes alcohol. It's no good, and you need to get rid of it. And so it's really amazing. And this conversation is not just about fertility, by the way. It's about your life plan of health and wellness. So it's really, again, I'm a fertility specialist, and I'm talking on the fertility side, but my sister Marie Ann passed of diabetes. It was really a hardship. I know my parents did so much work to try to make her better, but the American Diabetic Association, Heart Association, the nutritional associations, all basically, I think, steer us in the wrong direction because we like balance, right? Now, balance is kind of like saying it's okay to have a boyfriend or girlfriend along with your husband and wife, and balance is deadly. The razor's edge, you need to be right on line where you're going, and you can't mess around. Remember, you are the most valuable, expensive, irreplaceable entity, and we've been marketed to eat junk. I'm sorry. And it's not just the fast food. It really is even concept and ideas that healthy foods, fiber, fruits, vegetables, variety, may be deadly, more so than you know, because of the bacteria, the yeast, piss and poop and all the junk, and I call it nature's toilet paper. I know it looks so good and they market it so nicely. It's like we're taking in cocaine, and I know it's kind of really, really crazy. And Rob Billings, how you doing? Always a pleasure, everyone. And share this to your parents and your grandparents and your siblings and everyone. Keto's king, and Maria is helping rid diabetes, hypertension. And if you look at the movie, The Magic Pill, cancer, I mean, everything gone. And it's time we all take our own health into our hands and stop being led by the supermarketers who are supermarketing us right into the grave. And we want to lengthen the time before we get there. And remember, life can be an amusement park, but if you treat your body like that, it is not going to be so healthy. And really remember, temple, that's what we are, a temple. Hey Natalie, how you doing? Would you say that removal of scar tissue will ultimately increase chances of FET success with Guillain-Barré's? It's all about inflammation. Remember, inflammation is the very top of the totem pole, and it's the base and foundation of the pyramid. We want to clear up inflammation. And so where do I go first? Remember, slow it down. T has been doing 20 minutes of meditation every day. Twice a day is helpful for all of us. And when you bring in faith and change the thoughts in the mind, and if you haven't read Mind is the Master by James Allen or The Success Principles by Jack Canfield, I highly recommend it, because really we're forgetting about what's up here because we're struggling with the fear and the worry and the pressures, and our mind is continuously going down the sinkhole and making us more and more depressed. Get depressed, cortisol and epinephrine go up, oxytocin and serotonin go down. It really is a struggle. And so getting rid of inflammation in the pelvis, visual endometriosis, and I believe even going in there and doing the laparoscopy, the CO2 atmosphere when we fill up the pelvis may be a factor to reduce the white blood cell function, which is basically inflammation. But washing out the pelvis and excising endo or scar tissue, flushing out the tubes can be very helpful. And we're really spending some time looking at PRP, LIT therapy, or leukocyte immunotransfusion. So that's where the guy's white blood cells are injected under the skin of the woman, and that's the male allergy treatment. And either Nogales, Mexico, or Toronto, Canada, to Markham Fertility and Mike Vero, they do an awesome job. And again, this is not stuff that most of us even look at, but you know, I've seen so many that simply done the laparoscopy, hysteroscopy, DNC, a 14 to 30 day treatment of antibiotics, the keto, LDN, the Ovasitol, the other supplements, really is very, 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 very helpful. So, Sharonda Van Arnold, how you doing? Failed in 10 hours after transfer and drove 12 and a half home, went to work next morning. You know, driving and the stress, you know, that's a tough one. We have so many people that travel either through, you know, flying or automobiles, and I don't think it's a factor, but anything you could do to get some extra rest, maybe staying an extra couple of days to get some extra acupuncture, massage, spend some time in the relaxation room, a meditation space, or hanging out at the Maplewood or wherever you're staying. The Holiday Inn Express is our local hotel in Albany. We're seeing so many couples come up from New York City where literally we're able to provide a lower cost IVF because that's always been our mission: affordability, high quality, and offering self-financing. And I'm working right now that if you do 3 IVFs, you get the 4th for free. And you know, ask about it. And a lot of this is we're working to make it more affordable and accessible. So please share the likes, add the comments. Any comments that you bring to us are really helpful because we're learning. We've got such a great team, but they too can be challenged at this process because it's very emotionally difficult for everyone. Hey Katrina, how you doing? Well, let's see. First ultrasound, we're praying. After 7 transfers, we're praying. Now remember, once you're pregnant, we really highly stressed keto. Keto is the healthiest thing you can do in pregnancy. Going back to those crackers, those saltines are deadly. And when you're hungry, but you can't eat, don't eat. Rest the body. water, rest. Most of us carry the extra pounds of fat, which is the fuel for your fetus. And I really emphasize weekly intralipids. We're beginning to form a longer care group for those that are pregnant, Syracuse, Albany, Rochester, and Buffalo. And we're working how we can share it even globally, that while you're seeing your OBGYN, continue to think about the supplements, think about the keto plan, low-dose naltrexone, ovasitol, because remember, there's a significant increase in gestational diabetes if you're going back to that standard American diet. So if keto got you there, stay on it. Don't shift and change. And you may get some pushback by your docs, but they don't know anything about diet, nutrition, or the physiology of the running of your human Ferrari. So again, we've really just say, hey, have you read about keto? Have you read Marie Emmerich's? Have you seen Dr. Kiltz's live Facebook? And have you seen Dr. Kiltz's TEDx talk? And I've learned this from so many, and I'm so on it, I would bet $1 billion on this. And remember, your health and wellness, your children's health and wellness relies on changing what you've been feeding them. Cheerios and all these little snacks that we're just throwing at our children are going to increase the rate of diabetes, hypertension, cancer, all sorts of disorders at a young age, and we've got to stop it. Unless we take our health and wellness in our hands, we control it. That's so critical for everyone. So, hey, Lisa Cohen, how you doing? And I'm sorry if I'm not getting to everyone. I'm doing my very best. I'm really so appreciative of everyone. Why do some embryos take until day 7 to make it to blast? Do these embryos have a lower success rate than day 5 or 6? All right. So day 0 is the day of collection of an egg. We add the sperm to the eggs, either droplets or inject a single sperm into the egg. And then the next day where we check for fertilization is day 1. And say, usually by day 2, it's a 2-cell. By day 3, it's a 4 to 8 cell. By day 5, so 4, 5 morula, where it's beginning to compact. All right, so day 3, 4 to 8, day 4, morula compacting. Day 5, 6, and 7 is where the blastocysts show up. And some people believe that if it's a slower blast, it may not be normal. Well, it may be more likely to be normal. It's a day 5 or day 6 when it shows up. But even day 7s can be normal. And, you know, if you just throw it out with the idea that it's not normal, I mean, how many of us would have been kicked out of kindergarten and never made it to where we're at because of our grades or whatever our attitudes and lifestyle was? So we got to change it up and think a little bit differently. But I still believe we have plenty of day 7 pregnancies. If it's an embryo, it deserves to get in a uterus. And you and I don't control whether it makes it or not. We're working on Atlanta. Tahita Hill, how you doing? I hope I pronounced all the names right, and I really apologize if I'm not. Linda J. Brown, how you doing? And Menopure Only. So the Menopure Only is another option that we need to be looking at doing more, even with PCOS. If what you're doing isn't working, ask the questions. Hey, what can we do differently? It might be the same protocol, but even if you got a lot of eggs and a lot of embryos and they look great, but they're not making it, that's where you got to start looking at, okay, do we add human growth hormone or Neupogen? Make sure you're keto. Do we add more Menopure or less Menopure, or just make it Menopure only? Or do we make it only Gonal-F or Follistim only? And so, you know, there isn't a straightforward answer, because if we all, I mean, we have the recipe books. And if there was one, we'd pick them every time. And it's a game of persistence. And that's why we're really working on adding the fourth cycle. So if you do 3, every 4th is free. And so it's still $22.50 for a frozen thaw cycle plus the monitoring meds. And there's a whole lot of stuff, but really our job is to spread it around, let everyone know that affordability, quality, and access. And adding the immune treatments and adding food changes and faith changes and slowing it down and integration. So that's really, hey Harmony Dela Cruz, how you doing? And let's see, Kyla Nevis, how can my husband go from less than 2 million to none? Anytime there's a very low sperm count, you need to be thinking freeze sperm, freeze sperm. And you're always teetering between something and nothing when you're in that range. But there may be time to look into a biopsy, add the LDN, go keto, add the Clomid, the human growth hormone, and HCG. So don't forget about the human growth hormone for guys also. And it may be for guys, we should be looking at PRP. We should be looking at light therapy, and all these things can be really, really helpful. Hey, Angela Rogers, was on metformin and made her sick. Could take to lower my testosterone. So this is where the Ovasitol and keto is king. So remember, if you're eating a high carbohydrate diet, complex carbs, you push your insulin, which is insulin growth factor, which basically stimulates the ovaries and the adrenals to push out more testosterone. So by going keto, Ovasitol, low-dose naltrexone, those are going to help quite a bit. So I hope that was helpful. Hey, Melissa Potter, how you doing? Benefit of Neupogen. If you started at stims, and typically we're doing Neupogen with stims and beyond, but also using Neupogen in a frozen cycle to help growth factors and implantation. And now recently, Meg and Grace went to the Midwest meeting recently, talked a lot about using Neupogen and human growth hormone for frozen transfers also. And don't forget about hysteroscopy, DNC, and scratch procedures, where you fluff up the endometrial lining and help give it a more receptivity. And then there's Neupogen and HCG washes. There's Neupogen and HCG sub-Q. And sometimes you get like overwhelmed. There's too much. And sometimes you need to step back and do it a little more natural and slow it down. We do a lot of natural letrozole cycles with the trigger shot and then a transfer. Check your estrogen progesterone levels to decide whether or not we should be adding anything. And so I hope these comments are really good. And let's see, Sarah McCall, is it good to take inositol and keto? Absolutely. So inositol, Ovasitol, keto, and some people add the metformin along with that. And so, you can take both. And Emily Rowland had a good question there, and the absolute yes, you can. And remember, most people don't suffer from low blood sugar anyway, because your body makes the sugar. They do if you take insulin or too much of these lowering agents. So I really think it's important to go keto, paleo to start. And remember, there is keto, paleo for vegetarians and vegans. You got to add more fat, coconut fat, butter fat, cream. It really, really is helpful. And Kiltz's keto is bacon, eggs, butter, beef. I recommend one time at night before you go nap to sleep for the night. Remember, when you're resting, you're digesting. When you're up in the day and moving, a tremendous amount of blood flow is stolen from the pelvis, from the abdomen, and the brain, by the way. So, we can't even think, you're having all this morning shakes and healthy bars and all this junk, which really is no good. You're best a little bit of coffee, tea in the morning, water, and forget the shakes, forget the breakfast bars, and bread is bad for us. And this is a whole new turnaround, and you'll get a little bit more variety with Maria. And a really good book that I thought was really helpful in all this stuff was Volek and Finney, just kind of learning more about the whole process. But I think you don't need to know it all in order to use it. But the more you do. And hey, Patty, how you doing? Misty, Tori, how you doing? What is the wait length for embryo donation? Boy, the wait list for embryo donation is long. I can't even tell you, but we need to be encouraging if you have embryos that you're never going to use, please give them to someone in need. That's what we should be doing. We need to have that support group for those in need. Now remember, we can help make those embryos through donor sperm, donor eggs, or both. But the more we share the need and saving embryos and helping them get the opportunity to become a child. And that's what we need to be doing really, really, really well. Hey, Emily Schmidt, how you doing? What do you recommend in regard to exercise regimen during IVF protocol? Cardio, weights, yoga, sculpt program, vinyasa, flow yoga each week. Just wondering, I need to step down a little during my treatment. Absolutely. Slow it down. This is the good yoga. Tai Chi, meditation. You want to cool the body. All this exercise that we've been taught to do like gladiators is not good for fertility. It's downright bad. And so, you know, it is true that some people get pregnant on this stuff, but if it's not happening for you, it may be part of the problem. So, cool yoga, meditation, walking, Tai Chi. Listen to a really amazing book, uplifting, spiritual. Find something in your life that's going to help you. Faith, if you know, read the good book, whichever the good book that's going to put positivity in your brain that vibrates in your body. And spend time with your partner, with your family, with your friends. And when you share the stories, it gets it off your chest, off the back and the burden, makes you feel better. So I really, really recommend it. And remember, there's a lot of great fertility doctors out there, OBGYN doctors, a lot of integrative practitioners, a lot of naturopaths, acupuncturists, massage therapists, chiropractors. We're all focused and working together. There's not one way to do this. And if it's not working the way you're doing it, slow it down. So I hope I'm helping, giving you a couch potatoes in some way. You don't hear about too many couch potato deaths, by the way. So go slow, go slow. And guys, you need to be doing the same thing, by the way. You know, again, share the positive energy and the success stories and share what you did for success, even if it was just doing it again. And persistence, 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 and a positive attitude. I know it's hard, and I probably say and talk about it way too much. And if you haven't seen my website, Mind, Body, Smile, you sometimes want to shoot the guy, but it was my way of finding some betterment in my day. So, hey, Angela Saavedra, just got a positive transfer in the 8th. Let's see, when can I start walking or doing yoga? You can go nice and slow in the gardens. Light yoga meditation. You know, trying to do these crazy poses where your body has to really hold it. No way. And again, light and easy. That's what I recommend. Cool the body, not heat the body. I have no weight restrictions. I believe that whatever we think about obesity, it's not the cause of any disease. And if you read Robert Lustig's book, it'll come to me, it's basically the hacking of the mind. And it's a great book, a great read, and audio it. But if you're overweight, it usually means you're a high carb eater. And you're also eating too frequently. And so if you cut it way back and look at Maria's stuff, like you don't need surgery, you don't need to go on a diet. This is not a diet. This is a life plan change for all of us. And I didn't believe it. I did it, and I'm like, whoa, this is pretty amazing. The mind works better, the body. My eye doctor said, boy, your eyesight's better. And I've seen so many migraines gone, heartburn gone, diabetes gone, hypertension gone, arthritis and everything gone. And so remember, this isn't just for us speaking here, it's to be spread, because eating some healthy food and more of it isn't going to make you healthy. Eating far less of anything and everything is what's going to do. When you eat a high fat, low protein, near zero carb, that's the super fuel, and you'll feel amazing. And guess what? Fertility shows up on the male side and the female side. Libido increases. The hormones, I believe, are all put in the right place, because glycation, that's excessive glucose in your body from the frequency of eating foods and the high complex carbs, which are basically damaging your hormones, your receptors, everything in your body. And no one's talking about glycation, fermentation, plant antigens, and phytochemicals. So look at it a little bit more and spend some time reading about this, and you go like, wow, this is crazy, crazy, crazy. Ovasitol, Angela Rogers. So yes, inositol, ovasitol. Ovasitol is through Theralogics, and we use a lot of Theralogic supplements. But listen, there's a lot out there. Always start here, and then start with what you put in here, and make sure bacon, eggs, butter, beef. If you're vegan or vegetarian, then spread it out morning and night. Get rid of the seeds and nuts, which I think are deadly for us. So, and cauliflower, flour, rice, as a substitute, maybe. Hello, Jack Yeager. How you doing? Angela Rogers. Go all natural. It's the term clean or organic and all this stuff. It's confusing. You can't wash off all the dirt on the fruits and vegetables. No way. But basically, it is closer to nature what it provided. And if you stop buying the boxed and the bag stuff, it's got a label on it that has a bunch of mixtures and stuff. Like, eliminate it and get rid of it. Mighty Bonilla, I apologize if I said it wrong, is okay to transfer two PGS normals, age 43, yes. There is, but we're moving in more and more and more to do it in one embryo. We're doing some 2s, but almost no 3s. And if you're 43, 44, doing a day 3, no PGS testing, then 3 or 4 may be utilized in very, very rigid circumstances. But so thanks for all your comments, by the way, your likes, your shares. And remember, our job is to share it to the world and the community that is looking for, how can I get pregnant naturally without the fertility specialist or doctor, without the surgeries, pills, and shots? There are ways here, by the way. And that's what we're all talking about. Hey, Amber Reed, let's see. Thin patches, could it be from Lovenox? Let's see, day 5 fresh transfer, had my 5-week ultrasound Friday. Lining is thin patches, could it be from Lovenox? I don't know what they mean by that, but always be leery. You just gotta wait. I think everything you're on is probably still gonna be good. Make sure you're staying in the keto range. And we're seeing patients coming up from South Carolina, from Florida, from Georgia, from Texas, from Wyoming, from California, everywhere in the country. And please be patient, but when you share the words with people that they can learn with this, and if I need IVF, I'm coming up for IVF, we're working on how to get you in faster to the process, but we don't want to rush things. You see, my energy is usually pretty fast. We're trying to slow it down for all of us. So happy Father's Day again, and thank you everyone for the Father's Day wishes. I really, really appreciate it. It really is helpful. Wendy Cummings, yes. So if Clomid isn't working, 25 milligrams for the guys with or without HCG, then that's where letrozole may be helpful. Make sure the guys are going keto, and they're the lions for sure. Let's see. Joanne See, what is the difference between doing a Clomid cycle versus a letrozole cycle for timed intercourse? Well, we've pretty much switched over to letrozole because it doesn't have the same adverse effects on the lining like Clomid, but both work nicely. And we're doing a lot of timed intercourse, letrozole or Clomid, trigger shot, antibiotic, maybe a low-dose steroid, maybe intralipids, maybe some of the other enhancers. But remember, whether you're doing timed intercourse, IUI, IVF, fresh or frozen, donor eggs, donor embryo, gestational carrier, you got to think about all these concepts in the process. So thank you. Is inositol with D-chiro-inositol better than ovasitol? You know, we're probably cutting hairs in most of these, and I don't know that absolute answer. My bet, there's not enough real good studies to tell us that. So if you're taking one or the other, that is really good. Angela Rogers, thanks for the Happy Father's Day. And we are working to create fathers and mothers and grandparents and siblings. So that's our journey all together. And again, thanks for joining us on this Father's Day evening. And I went and spent some time with my daughter today, had a beautiful lunch, and it was really, really wonderful. And again, we should all be thinking the same thing. Let's see, Tiffany, IVIG, wife can't do eggs. Well, let's see. So intralipids have egg protein and soy fat. So IVIG and adding butter and cream maybe. These are some things that you might do in order to increase the fat, but also the IVIG, Humira, Plaquenil, the anti-inflammatory medications can be really helpful. And remember, don't forget the laparoscopy, hysteroscopy in order to remove or reduce inflammation. And for guys with the varicocele, a ligation either surgically or radiologic may be helpful for you. Let's see, HSG, hysterosalpingogram, sometimes, let's see. So if you have proximal tubal obstruction, doing the hysteroscopy with selective tubal catheterization may open them, removing debris or a little bit of scar tissue, or it may prove that it may have just been a spasm or not enough fluid at the time of the HSG. So I definitely recommend the selective cath for proximal tubal obstruction. If you have distal obstruction, bilaterally, you got to think about surgical correction, either repair or removing the tube. Sometimes you get in there, it's a little bit of scar tissue, and you can repair it easily with a course of 30 days plus or minus antibiotics. I think is really helpful. If you have one normal tube and a hydro on the other, by removing the hydro, salpinx, you'll actually help conception naturally. So, and there may be some methods with massage and acupuncture and meditation that may help clear up some of this immune problems with maybe a 30-day antibiotic where the body is going to help clear and cure itself. But if that's not working, think about the laparoscopy, hysteroscopy with or without salpingectomy. Let's see, Jill, Tracy, how you doing? Boosters, yes or no? I've been pushing more and more to the intrauterine HCG Neupogen plus the sub-Q Neupogen before transfer or with transfer. And then I'm not a big fan of the HCG boosters before the HCG, but I generally recommend adding it 250 units a day once you've had a positive HCG and take it until about 8 to 12 weeks. There's a lot of pushing longer and longer with progesterone and steroids. When you finally get that BFP, right? It's like, okay, what are all the things that we can do to help maximize implantation, minimize miscarriage and loss? And chemical pregnancies are hard, but think about laparoscopy, hysteroscopy, immune treatment, ovasitol, all these things that we've been talking about. And again, thanks everyone for hanging out with us for this near hour. Really appreciate it. You know, send the comments and likes and share. And remember, whether it's fertility or something else you're challenged with, it really is helpful, this conversation. And we're seeing so many women and men who are considered overweight conceiving because it's not the weight, it's the inflammation because of the excess carbs. You can clear up much of this inflammation in a few weeks, and many people will just begin to lose the pounds significantly, 25, 50, 75, 100 pounds. It's quite amazing. So, is keto safe for diabetics? Absolutely. Look at Ellen Davis's website. It's ketogenicdietresource.com. And everyone should be on this diet, in my opinion. It's a life plan. It's a live it plan. We got to get off the diet plan. It really is hurting us. Hey, Francis, how you doing? Particular, thanks for sharing. Hey, Patty Mill. 2 regular cycles in May and June after stopping DHEA. My first since October weren't preventer-induced. So stay. Well, you know, the DHEA, 25 milligrams 3 times a day, may be something that you should be on until a positive pregnancy. Some people talk about using it vaginally. I'm not telling you to do that. I just recently heard from the meeting that some people are using it that way. But I say stay on it for now. And again, keto is king for all of us. It doesn't matter your age. Children need to be going keto. Get rid of all of our problems. Well, never all of our problems because we're humans, right? Let's see, HGH and it's affecting cortisol levels. Well, let's see, this is from Tara Sturgis. You know, I haven't seen that. I think in general, you know, we want to keep cortisol levels lower, and that's where going slower is important. And let's see, an IVF cycle, 3,900 plus monitoring and meds, and 250 for every frozen transfer out of that cohort of embryos until you deliver a baby, and then it goes up to about 1,900. But again, that's for the first, second, and third cycle each, and we're always working on ways to help. We do self-financing for everyone. There's a little bit of an additional charge for the finance cycles, but it still beats nearly everyone else. Let's see, again, thanks everyone for Happy Father's Day. Boosters, got that one. Justine, always a pleasure, and thanks to all the support of our team, Dr. Corley, Dr. Ditkoff, Dr. Grossman was at the door helping, Justine, nurse practitioners everywhere, all of our staff, quite amazing. I'm really, really, really grateful. Hey, Sandy Young, 40 pounds, 3 months. Awesome, great job. And I think keto, you may see a little bit of thyroid dysfunction in the first 2 to 4 weeks, but my bet is it's your body fighting back. Just give it some time. I bet it's going to smooth out over time. Keto cures thyroid dysfunction also. So don't give in too fast. When you do, you lose it. Keto and pregnant. Remember, for so many women, they have the extra pounds in pregnancy because we're meant to get fat to store the energy, because fat is the only energy for the fetus. And so you can eat all the carbs you want, but they must be converted to fat before they're ever used as energy. So it's a crazy concept, but you will lose weight in pregnancy. You're going to use the fat. And for the first trimester, let it be. Now, obviously, if you're underweight, you got to add the fat. And remember, when you eat fat, it's twice the calories of a carb or protein. You eat less, and it suppresses appetite, and most of all, it suppresses inflammation. So that's really the amazing concept here. And let's see. Keep calling about cancellations. And again, we're really working to get the tools so we can help get you moving faster. We do tubal ligation reversals and vasectomy reversals. I do the tubal reversals, $7,900, which includes an IVF, and the vasectomy reversal the same, $7,100, which includes an IVF. Dr. Trussell does the vasectomy reversals, and I do the tubal reversals. And hey, Melanie Rosales in Florida, I love to be there. We're stretching, all of us, and we're trying to keep us just as sane as possible on a great path here. And keto, Daniel Torres, this is a good question. Keto and prolactinomas, and my bet is prolactinoma is going to same thing. When you get rid of the inflammation, you're going to reduce the glycation, the plant antigens, and all these things that cause tumors to grow. And so it is amazing. Let's see. Pituitary tumor is the only known fertility issue, no male factor. Well, always a male factor, always a female factor, always a sperm factor, always an egg factor. It might look normal on both sides, or one has got a problem, the other one doesn't. It's always both. So we have to change our thoughts in this. When we keep on saying no male factor, no way. Always male, always female, always combined. So, but pituitary tumors, all tumors, fibroids, adenomyosis, endometriosis is an inflammation problem from the standard American diet, high carbs. It's killing us. We got to get rid of them. Remember, our body requires 0 carbs ever to be consumed. It doesn't make any sense, I know. And don't believe me, by the way. I didn't believe it. I did it. And then like, whoa, 0 exercise in 10 years. Bacon, eggs, butter, beef, occasional little this and that, fries, but I really eat almost 0 fruits, vegetables, and fiber. If I'm gonna have a carb, I'm gonna have fries from time to time. And my ice cream, check out Dr. Rob Kiltz's ice cream recipe. It's amazing, and always looking to share. And Toronto, Montreal, Dr. Faruqi, but our team in Buffalo sees so many people from Toronto. We're here to help, and whatever we can do from all sides, from coast to coast and around the world, we're just sharing new and different ideas that we're here to help you. Whether you come to us or not, it doesn't matter. Talk to your acupuncturist. So, and Ann Wong and Ithaca, amazing, and Heather Smith in our Rochester office, and Don Clark and Chi, and Jennifer Waters. And I know I'm not mentioning everyone, but really I can't do this without an amazing global team of healthcare providers who are shifting the way. And remember, we do standard American therapy, but we also integrate a new and different approach. So let's see, April Smith Foster, how you doing? Really curious, so I'm gonna post it again. Does transferring 2 embryos decrease your success rate? 1 or 2. No one really knows that answer because we're not randomizing those patients. Some get 1 and some get 2. It's really preference. If it tends to be, if you're a really good candidate to put in 1, you may have a higher probability, but there's some discussion that by putting in 2, you're gonna have a little bit of a fight there. But my bet is the 2s probably will trump the 1s in overall pregnancy, but it may be because of the twins have higher complications. There's going to be a push more and more to of the adverse effects of that. So we're really pushing for the 1, and I'm sorry I may not be cutting it right here for you, but you know, we do 1 and 2. Our preference is 1 in the failed cycles. Looking at 2 may be the issue, and then you got to watch because many of those twins will reduce down to 1 naturally without having to do a reduction. Let's see, the Keto Bible. You know, there's a lot of good stuff out there. I do a lot of audible books on keto, and the Keto Bible is good, by the way. But, you know, I tend to be a lot more strict in the conversation. they still talk about burning sugar first and then converting to fat. And I don't believe that one bit. We always burn fat as energy, acetyl-CoA, in the mitochondria. The glucose and the amino acids must be converted in the liver to fat or you're dead. Type 1 diabetics and liver failure. And so it's conflicting, I know, but I'll bet $1 billion on this one. Most of us are wrong of our scientific world, and I know it's, how can you push that? Let's see, Sandy Young, it's hard first, but it gets better, more energy. Yeah, it is hard at first, but keep going, by the way. Remember, when we're addicted to carbs and sugar, your body's going to fight you like it was cocaine or some other drug that we're addicted to. And your body's going to say, but I need it. You need oxygen, water, and fat, and a little bit of protein, and zero carbs ever. Remember, fresh fruits and vegetables, they look good, don't they? I say they're deadly, and it doesn't make sense. Hey, Gia Zecker, how you doing? Thanks so much for your comments. We really appreciate it. And really, remember, we're sharing ideas and energy for everyone at every fertility center. Ask your docs, what do you know about keto? I heard about keto, and integrate it, and integrate Eastern Western. It really is amazing. And there's a really great app that, that Faring has put out on meditation, and it'll come to me. So we'll get back to that. So a couple more minutes. We're probably already after. Sorry about that, everyone. And just, Sarah's got Sarah Petite Born. Let's see, Brimmer. Fresh versus frozen. We've really pushed more and more to freeze all and frozen. If you have enough embryos, do a fresh. And if it doesn't work, a frozen. If you have only a few embryos, think freeze all, whether it's a day 3 or a blast stage. They both work really, really well. So one is not necessarily always better, but if you have a high progesterone, a high estrogen, a lot of eggs, we're pushing more and more going to the freeze-all, especially if you're at higher risk of ovarian hyperstimulation syndrome. Now more and more we're triggering with the Lupron, so it's reducing the OHSS, but a co-trigger with Lupron and a little bit of HCG I think is helpful. It may improve the egg quality. But remember, one other thing to add on is natural cycle IVF or letrozole or a mini cycle where we're using a combination of letrozole or Clomid with 100 to 200 units of Follistim, Gonalef, or Menopur, or some combination. A lot lower cost, potentially a fresh cycle, which is included in the 3,900, so you're not overstimulating, and it's going to give you a good chance of success. And for those that make only a few eggs with high dose of gonadotropins, the low dose may just do just as well. And our standard dosing is in the 300 range, high dose 450 to 600, and a low dose is between 75 and 225, but there's a little bit of variability. In general, the heavier you are with the lower AMH and the higher FSH, we're going to go higher, but it's not a like one size fits all. You know, you do something and you see how you respond, and then you change it up a little bit. Bacon, bacon, bacon. Remember, bacon babies. B-E-B-B, bacon, eggs, butter, beef. And remember, if you can't eat pork, beef, bacon is amazing. And you know, affordable health care, you know, it's a tough one, but I tell everyone, put $10, $20, $30, $40, $50 in a baby bank every day, whatever you can do. It adds up over a month, over a year, and suddenly you have the money to afford your fertility care, and that's the money that you're going to also be putting away when you have your baby in your arms. And it was such a blessing, beautiful thing to see all the success stories at the Rosemont Gifford Zoo, patients from Ohio, from Albany, from Mass, from everywhere. We've had people from England show up, Australia, to come to our yearly zoo party. It's the Saturday before Father's Day every year. We're really just putting it out there that everyone gets success, comes and join us, and maybe the next is we do it virtual. I'm really thankful to Jared Campbell and Billy and the Chicken Nuggets, they called them, Bubble Man and Wacky Chad, and everyone at the Rosamond Gifford Zoo. We're grateful for everyone then, and it was just pretty amazing. So thank you. And again, you're learning something here that you can start the journey and change what's going on in here. And we're looking for the I'm pregnant au naturel. That's what this story is really about. The more and more and more I've shared this, the amazing I've worked in. So, Lena Connor, thank you for your comments. Sandy Young, Sally Patterson Hook, and yes, I think we're doing a 5% military discount. Ask about it. And Kelly Hurst, PCOS. I have 30 plus follicles when I went into ultrasounds. Clomid didn't work, letrozole didn't work. What do you suggest for someone with my condition? Well, if you're making that many IVF, we do an egg reduction procedure, and then you follow with an IUI with only 2 follicles, or intercourse, by the way. You could bank some eggs or embryos, or you just freeze them all and you come back and you do another cycle. But this is where ovarian acupuncture, ovarian drilling comes in with that laparoscopy, keto, and again, the ovacitol, massage, acupuncture, and sometimes you go longer with letrozole, 10 days or longer, and you go low and slow with the gonadotropins, even 30 days of 50 units of Gonalef or Menopur only. It sounds outrageous and it's opposite and different, but it's really, really, really crazy. Let's see, Shakia Falls, Neupogen after FET. No, there's no musts here, by the way. You can literally do a natural cycle, transfer an embryo, do IVF au naturel, no extra meds. It is a little crazy how much we're throwing on this. Sometimes you want to just take off the blanket approach and keep it really simple, right? And we've seen so many where we've done everything and then you've just done like almost nothing, and voila, it's amazing. So, and we need the male group, we need the female group, we need the everything group, but this is the family group, the CNY Fertile Family Group, that's helping support everyone, even in the pain of this process that you want to yell and shout and be frustrated about what we're doing wrong and all this stuff. Share it. And prayers and to everyone that's going through this really difficult process. Every day when we all join the prayers of success, the prayers of the journey, it really is important. And the vibration of our brain energy, really, really important. And so let's see, Neupogen or natural. So I'm not sure, I'm gonna go back to that, but the Neupogen can be either with a stimulated, a natural, low dose, or not. We look at your story, your history. A lot of times we give the menu of possibilities, not the absolutes. Because don't you want to know about all the things that you could do that may increase your odds, rather than what I have to do in this. And Aaron, Yoga for Fertility, really grateful. And Lisa, thank you for your support and prayers to your family, by the way. Lisa, Grace, and Meg, and always prayers, everyone out there in this crazy journey of infertility. All right. Oh, priming. 30, 60, 90 days. I think I'm going to finish up with this one, by the way. That's what this whole conversation about is. We're priming and prepping our bodies for the best sperm, the best eggs, the best implantation environment, the best relational environment. And 30, 60, 90 days or more, or even just 2 weeks, keto, paleo, slow it down, visualize, remember the vision board of your success. That's what you want to put out there. Read Jack Canfield's the book, The Success Principles, or Rhonda Byrne's The Secret. And check out our book, The Fertile Secret, and we're working on the keto secret, by the way. It really, really, really matters. And again, thank you. And share this, share all of our stories. Through the stories, we feel like we're connected, and we can see a crack in the dark to bring in the light, to give us a path to your success. And whether it's adoption, donor egg, sperm, embryo, gestational carrier, or whether it's finding the joy and happiness in the day as we have it today. Thank you to everyone. Bonnie, Ananda, Imani, God bless. To everyone out there, my blessings, and thank you for sharing this beautiful Father's Day. We're all working to create mothers, fathers, grandparents, and siblings. Dr. Rob Kiltz, God bless. Enjoy.